peripheral arterial disease is incredibly serious, and the reason why it's most serious is that nobody's talking about it.
I'm a retiree from Chrysler Corporation, and I worked there 35 years, and retired at 55 and was glad to retire. Enjoying the life now I've wanted to do all my life. Enjoying my family and kids, my little dogs, and my car. I love my car.
I was an athlete, and I was running from Oakland to Milpitas back and forth. That's like 80 miles. Nobody doing that, you know.
I ask patients, so what are things that you like to do, and have you been unable to do some of those things?
I love to play golf, and I was having a lot of trouble on the golf course. Standing, swinging the clubs, walking, carrying the golf clubs, and that was very annoying to me.
I couldn't go through a normal day at work because I was loading trucks, and my flow couldn't go down my leg, and I was cramping up. So it would stop me from working.
And then it advances to the fact where you can get pain without even moving. And then what happens is if you don't get blood supply to an organ, that organ dies.
And that's scary, because I was still a young man.
And that can lead to putting you in a place where you're in jeopardy of dying.
PAD refers to peripheral arterial disease. That's narrowing of the blood vessels, usually because of cholesterol buildup within the arteries. It occurs really between the carotid arteries, which can cause stroke, or the arteries of the lower extremities, which can cause debilitating symptoms when people walk, or even lead to tissue loss and ultimately amputation.
Oftentimes in our community, we talk about having poor circulation. And then what happens is when you don't have good circulation, you aren't getting good oxygen to your extremities.
They put blood pressure cups on my arms, legs, and to check and see if the blood flow and everything is fine.
That can identify peripheral arterial disease at a very early stage.
Then they do ultrasound on my groin area, my legs and everything.
When my wife was pregnant, we do an ultrasound of the baby so you can see the limbs and such. And we use that same type of technology in looking for peripheral arterial disease. So it's an ultrasound machine that we look at the waveforms that give blood supply to the legs and see whether or not there are any indications that the circulation might not be where it needs to be.
Okay, that's it.
And in this instance, there's absolutely no discomfort associated with getting a blood pressure cuff placed around one's ankle.
Nope, it wasn't painful.
If you're telling your provider that you're having pain in your legs when you're moving around, and you can tell that the provider maybe isn't concerned, but you are, that's a red flag. You know yourself, and our patients know when something's not right.
What I know now is you have to check your body, and you have to check with your doctors and let them know what you're feeling. Be truthful and honest, and be upright with them all the time, and that's the only way you can get help. If you don't let them know what's going on with your body and how you really feel, they can't help you. They can't do anything for you.
The other very important piece is make sure that your physician takes off your shoes and your socks during any exam.
And that can provide the diagnoses to open up all of these treatment measures for peripheral arterial disease and reduce the risk of heart attack or stroke.
Yeah, don't be afraid. You need to check it out because you might die from it.
So peripheral arterial disease is very serious and is underdiagnosed. So I often use the term that we often hear about heart attack and brain attack, but we don't talk about leg attack.
I thought they were losing their mind. I'm trying to figure out where did it come from and why. And no one could really tell me that. They says, well, that's something that happens as you get older. But it's not. There's something that's going on with your body.
I was pretty scared, because my mom died from cancer. My dad, he had strokes running our family.
People that are at risk or have known heart disease or have had strokes are at risk for also having decreased blood supply to their legs.
People in my family never had problems with circulation or anything of that nature.
So sometimes it's a little bit unclear about genetics versus our environment, but clearly what's important to state is that our environment, where we live, where we work, where we play, all those things are important.
I didn't go to the doctor. I waited till I was almost going to lose my leg.
As the Black community, I think we need to be more engaged in terms of seeking care earlier in our life cycle, because oftentimes what happens is that we present later in our disease state, and then that makes the treatment algorithm more complicated.
There's no actual peripheral arterial disease treatment, but the treatment is focused on the risk factors that led to the peripheral arterial disease.
So the main risk factors for peripheral arterial disease are tobacco use, diabetes, high cholesterol, hypertension, right? So I start there, and the list is much longer, but those 4 risk factors often contribute to multiple other end results that then often lead to worse outcomes, right?
I was kind of like an athlete. I really didn't smoke a lot, but I was around the people that smoked a lot, It just happened when I was 39 years old.
General recommendations to any patient is that our diet should be low in salt, low in sugar, and eating healthy fats, and we should all seek to get 20 minutes of exercise or activity each day.
I love French fries. Love eating French fries every day, But Dr. Ferguson said, you need to start dieting, and all that, walking or doing something.
We know that exercising actually increases the blood supply to the lower extremities.
As long as you check and make sure you're eating right, exercising, you can do anything you want to do. And don't let anyone tell you that you can't, because you can.
Most patients with peripheral arterial disease should be managed with some type of statin, cholesterol medication to reduce the fatty buildup within their arteries and to reduce the progression of that fatty buildup within their arteries.
I take the medicine because it keeps me from cramping up, It helps me a whole lot with my flow.
The meds are working, and they're working very well. I have no complaints. I know when I don't take them, which is very rarely, but if I don't, I know it, and I'll jump on it right away. Then my wife is on me constantly. Did you take your meds? Are you doing this? Yes, I am, baby. Yes, I am.
Early identification, patients ask sometimes, why do I have to have my hypertension treated, why my diabetes? It's not inevitable that a patient that has any one of these conditions will go on to develop peripheral arterial disease and ultimately the most fateful consequence, amputation. It's not inevitable. If we identify those conditions early, we can prevent the development and the progression of peripheral arterial disease.
I want to get back to running. I used to do a run, and it was called Watts. I want to do that run again.
It is a disease state that we know a lot about now, and we have a lot of things that we can do to increase poor circulation. But one of the main things that I think that we do too much in the Black community is play our WebMD. So we just assume, oh, well, I'm slowing down, my legs hurt a little bit, that's just arthritis, or I'm just getting old. But we need to understand that this might be something that's correctable. And peripheral arterial disease is something that we should be asking our providers about.
Yes, I follow my doctor's advice thoroughly, all the time. Never deviate. That's why I'm there at 76.